All right, everybody, welcome to this meeting of the Dunn County Health and Human Services Board. Our first item is the call of the roll, and let the record show that all members are present except for Supervisor Breslin. And our first item of business is a public hearing on the required public hearing on the Department of Human Services 2025 budget. The purpose of this is to generate as much feedback as we can as the budget process proceeds. And as indicated, it is that step is required. Has anybody indicated that they wish to participate in the public hearing?
No, it was advertised and I did not receive any comments back.
Okay, but it was
Or-
appropriately noticed.
It was appropriately noticed.
All right, then in that case, I will turn this over to you, Ms. Winter, and you can walk us through this.
Sure. So to my right is Jerry Rumpel, and she is the budget guru here, helping with the DHS budget. And so I asked her to be here. So if we have specific questions to help,
Perfect.
then she could help answer them.
Thank you,
I
Jerry.
do have a PowerPoint and it's more of a summary versus the millions of details of lines that you received in your packet. I do want to start this off by saying, though, this is the first draft and there, will be additional drafts set forth. We were a little bit time constrained because of the fact that we had to have somebody, one of the financial people enter the data and they had some time out of the office and it took a little bit to get it in there. And then we did have to kind of rush through it. And so we did not get 100% through, and that will be worked in the second draft, just so
Okay.
you're aware of that.
Okay,
And that is, most of it is in the behavioral health unit, but at this point, this is where we're at.
okay, well, the public hearing is officially called to order, and I'll turn this over to you.
Okay. All right. So I have a PowerPoint up here for you. The things that we really wanted you to know about this budget are that there's three different areas that impact the budget that are different than last year. We did plan for a 2% salary increase and a 2.75 step increase when applicable. And why that's where applicable is because some people are already at the top of the scale. And so then they don't receive that 2.75. So when people are eligible somewhere in that scale, then they do that. That was directed by the CFO as far as what we should put in the budget. For now, that can always change, based on county board or your decisions
Right.
with that, but that's what's in here. And I also want you to be aware that we did have to reduce some of the staff that we have currently in the department. And so there's 6 people that we're reducing positions for, and it equals 5.35 FTEs because 2 of those people are part-time. Dr. Hall.
So my question is whether you're reducing staffing in order to make the budget work, or you reduce the staffing for other reasons already?
Yep. So that goes into our next category of reduction of revenue from grants. So we had several grants that were ending, it sunsetted. And so with that, the staff that are doing the programs, because the grants ended, then those positions ended. And some of them were hired knowing that. Some that, like in our FEP program, our choices program, we had 2 staff leave. And so we chose not to backfill them. And so they're already, that process is in place and not filled because we knew there was some funding concerns with that program and being able to do that. And in addition to that, and I'll get there a little bit later, but the number of consumers right now is down. So we felt it was appropriate to do that with that program. So it's strategically done as far as that reduction of staff. And then reduction of revenue also from Medicaid and other insurances is $109 15,372, and that's based on this year's history so far of what we're projecting. And so we wanted to make sure that we were accurately displaying that based on what our projections are this year in the 2025 budget. So, and I
Almost
forget-
$800,000
Right.
in
Revenue.
reduced revenue. That's a fairly
It
substantial.
is. It is.
Yeah.
And then you've got the increase with the salary. And I believe that at least last year, what happened with the salary is we were allowed to come in with a zero budget, but then we were reimbursed for the salary increases by the county budget, I believe, or through the county funding. And so that's not shown here because, it's not showing that we're receiving additional funding for that. Okay. Any questions on that, those points? Okay. So then we kind of go through each area, and I want to start with the totals so you could see that first and then break it down. In the totals, we have the revenue of 16,175,219, and of course that's down because of what we just talked about. And then expenses here, the total expenses is 16,998,735. We know that the salaries that are in here have increased by 10,000. The salary and fringes based on what we just explained with that. And then our operating expenses also increased by 6,715,702. And that is just like at home, your operating expenses increase when prices go up, all of those kinds of things, so that is a difference of 823,516 between the expenses and the revenues. Is that good?
The salary and fringe and the operating make up that total
Yep.
expense there. Yeah.
Yeah, so what Jerry is, you can speak.
Jerry, absolutely.
So-
Speak up.
So you have your expense total there of 16.9 million, and then the breakout of that is 10.3 million of it is salary
Right.
and fringe, and 6.7 million is your operating.
Right.
expense.
Right. Does
To equal
everybody
that.
understand that? Okay.
And so.
Thank you, Jerry.
And then, so we have a negative balance of
Right.
23 between those two. So this is something new this year that you didn't see last year. We are working on the ERP, which is the software program that's potentially replacing SAP that is sunsetting. And so we have some staff in our department that have a large portion of their salary allocated to ERP, and we've had to backfill or do different things. So the salary and fringe for that, for those individuals for this project is 71,000, almost 72,000. And at this time in the budget, there's no revenue in there to replace that. So that's something different than last year,
Yeah.
just so you're aware. All right, so AMSO for new people or those that may still be confused about AMSO, that is our overhead. So in our department, what we do is any overhead type cost, like for example, my salary, Jerry's
Jerry's,
100%, all of that, our support staff, pens, paper, all of those kinds of things are part of AMSO. And then what happens is they are split by the number of staff in our department. So a portion of that is allocated to each staff, which is allocated to programs. If they're split programs, it can be split. They might be split 4 ways to the AMSO amount, but that's how that's all figured out. It's by FTE. And so it's the salary and fringe and any operating expenses, which again is like paper, pencils, printer costs, all of those kinds
Right.
of things. So the revenue right now in that area from the program area is 1,124,000, and then we have the expense of 1,374,000. So as you can tell, it's a little bit over in that area as well. But again, that salary and fringe could be a piece of that with having
Yep,
that
yeah.
increase. Yep. Okay. Behavior health. In this category, it covers all of our behavior health programs. And so on your budget sheet that you've seen, it was split out by crisis, CSP, CCS, the clinic, APS, all of those kinds of services. And so here we just summarized it for you with the revenue of 3 million and then the expense of 2.9. So many of the programs that we listed either have, like the FEP program should be 100% grant funded. The CCS program, is funded, and CLTS. We also then have like the clinic CSP crisis that we get a portion of it back from billing, but not all of it. So at this point, it looks like we're actually a little head in revenue for that unit.
Mhm.
And the one thing, or a couple things I wanted to point out in this portion of the budget, we added something new this year, and that's on call for our adult protection services. What's happened, I think I've talked about this a couple different times, as our numbers continue to go up in adult protection, and our on-call after hours calls are coming in on a regular basis. And we've done some mapping with that, looking at data, and what's happening is our workers are taking those calls after hours, and they're not getting any reimbursement like our other program in family and children's. And so we looked at, can we do this this year or 2025? And the cost, we just use the same comparison as the family and children. So that's almost 13,000 there if we implement that. So that is new. And it's something that obviously if we need to cut out because of budget, that would be something new, but it's challenging to ask people to be taking these calls without being paid for being on call.
Yeah, for sure.
Yep. And then again, I mentioned that the FEP Choices program we reduced by 2 FTE with vacant positions. So any questions in that area? Okay.
That's the first episode psychosis.
Yep.
Program. Okay.
Yep, I'm sorry.
No, that's all right.
Yeah.
Go ahead, please, Supervisor.
Thank you, Madam Chairman. I might have missed it, but how many people are you laying off?
So let me go back to. Yeah, it's
Okay.
6 people, but 5.75 staff FTE.
Okay, so out of that, how many of those were completely funded by the county?
None.
None.
Okay,
They're grants.
okay, so we're not laying off any permanent people, basically. Okay, thank you.
Well, they were hired.
I didn't think so, but-
Yeah, the ones in the one grant, they knew it was a pilot grant for the ADRC. And so they knew that that grant may end in March of 2025. And so they were told that upon hire. The other one was the first episode psychosis. And when people just left, we had 2 staff that just left that were not backfilling. So they weren't, but they're grant funded. They were grant funded.
Thank you.
All right. Oops, I messed up. CCS wasn't in that last one. My apologies.
But it's here now.
It's here now. My
That last one
apologies.
was actually the behavioral.
That was the clinic. You should speak up if I'm wrong. Help me. So this is Comprehensive Community Services, CCS. And typically you have seen that this would come out even because it's a fully funded program. And what happened here, and I think I've mentioned this a couple times, is sometimes when you're adding additional staff that are non-billable, and that's what we've done a little bit of a manager staff, an extra manager staff and an extra support program assistant staff, that you have to then bill them through the WIMCR system, which WIMCR, it's a lengthy process, but what happens if for expenses that you can't put through for billing Medicaid, you can bill WIMCR, and there's some money on the back end that comes, but it doesn't come till the following year. So like, for example, this December, somewhere in there, we will get reimbursement for 2023 expenses. So,
Drives the accountants crazy.
but we do get it, but it's just behind.
Right.
And so because we increased a couple of those positions that were non-billable, because the supervisors aren't seeing clients, that kind of thing that they can bill directly, and the support staff, then that's what happened there. So we'll
Yes,
pick it up.
Supervisor Steen, go ahead, please.
Yeah, I'm a little slow processing things today, Paula, but of the people that you're asking to answer the calls for no pay, are they management?
No.
They're hourly?
Yes,
I
or
don't-
salary, but
Okay.
salary, but
That's my point.
Front line.
Yeah, they better be salary, because if they're hourly, you can't do that.
They can do it, they get paid for that time.
Well, yeah, that's what I
Yep.
mean. You can't ask hourly people to not
Right.
get paid.
Mhm.
So,
Right.
okay, that, thank you.
I'm with you on that.
Okay, any questions on CCS or anything I missed? Okay. Crisis. Oh, I didn't change this, sorry.
That's all right.
I thought I took it out and now it's not. I must not have saved it. So I thought there was a reason here and Jerry and I talked and there wasn't, so I was taking it off. I apologize, it's still on there. So revenue in crisis is 469 and then the expenses is 530 with the salary and operating expenses. So again, you see there that there's some increases with that,
Right.
with the salary and fringe. All right. Community support program. Revenue of 545 and expenses of 461. Now with the crisis and the community support program, you're going to see later on in the agenda that there's a resolution to ask the state to fully support these two programs. So I just wanted to connect the dots with this. We are over at both of those programs and needing additional funding for it. So Family and Children's Unit, you'll see here a difference in revenue here and expenses again. Quite a difference there because we've had some high needs placements of youth and also we've had multiple sibling groups. So when you get 5 kids in a family that need to be placed or that, it just really increases it very quickly with families. And so that is what's going on in that unit right now. So projecting that from this year and the current trends that that's what next year potentially could look like. Economic support unit. That unit is just really close to being fully funded. So just a couple dollars there. All right, Aging and Disability Resource Center, and then the nutrition program is along with that. This is an area that got hit hard with ARPA grants that's ended this year. So about 2025, that's, so you'll see here a little bit of difference here between the revenue and expenses. In addition, this is the ILSP grant that the staff that I was talking about that were informed that this is a pilot grant that would end by the end of March 2025 potentially. That is, so there's some difference between 2024 and that and the staff there as far as that unit. Any questions on that?
Mr. Lamb, do you have a question? Thank you.
Okay, Children's long-term support waiver. That is really close. We got $10,000 their difference basically. So the increase in salary and fringe is probably what's you're looking
Sure.
at there. Birth to 3. There's quite a big difference here. So the grant supporting the birth to 3 play group. And we also receive ARPA funding from public health. Thank you, public health, but that all ends. And the male hometown grant ends. And so we will be, that's one of the employees that will be ending at the end of the year. It was a 26 to 30 hour position that was funded by the public health ARPA grant, but that will be eliminated. And we are working on other ways to look at supporting that birth to 3. Becky, I know, is working on another grant. I'm potentially looking at the ability of moving some funding that we get in another grant into the birth to 3 and hopeful to use some opioid settlement funds maybe for the other funding. So I'll be bringing that to you if that is agreed upon. And we have a work group tomorrow talking about that. So hopefully we'll be able to bring some of that forward to hopefully cover that as well. That's about 30,000. So there's a.
This might be a place where the Community Foundation of Dunn County might be willing to step in with grant support.
Is that the grant you're writing right now?
That's who you're writing for. All right. great ideas.
They
Okay.
said though that typically they do about 5,000 and Becky's asking for 20. So we'll see. Try to get it, see what happens.
It doesn't hurt to ask.
Right. So just kind of, oh, Bremer too? Okay,
That's true.
okay.
That's true.
So write that down, Becky. So hopefully we'll get that backfilled. That's the
Yeah.
31,000, something like that. But there is still a significant difference here.
Yep.
And the interesting part is it actually was a significant difference last year as well in the budget. But there was some other funding from other units that was able, in 2024 that we were able to move over. So when we maybe bring this back again, hopefully we'll be able to shift some of that funding. There's our team.
I love that picture.
Yeah, so it was an all-staff day and we, it was during the Public Safety Awareness Week and support for them. And so we all wore yellow to support our public safety personnel in Dunn County. And so that was a lot of our staff, but not everybody. There you go. Any questions?
Any questions for Miss Winter or for Jerry? Supervisor Steen?
Thank you, Madam Chairman. Can you give us, at this point in time, I know it's maybe an uneducated guess, but how do you see the budget at the end of the year next year? I mean, or how do you see this
For
going
this year?
forward? Well, we've been lucky the last few years, we've been able to generate money back. And I'm
Pretty good for this year.
well, this year, but I mean for next year, you know. And I know this is you're shooting in the dark, but I mean, with all the cuts and based on your projections, any educated guess that you or Jerry could give me?
So this year, I mean, you'll see that in the packet that is it.
Yeah, the financial report was here.
Yeah, this
Yeah,
year's
yeah.
600, but again, that can change.
Well, I understand that.
Yeah, pretty quickly. So it's hard to tell, you know, like what that would be next year until we
Yeah.
do those projections, but hopefully we could
And
continue.
placements and all that
Yeah.
stuff. It's so hard to predict.
I understand that, so.
Yeah, I mean, it's certainly not as much as it was the year before, just because of the way that the budget was done with vacancies and those kinds of things, which is, I support it was a smart move, you know what I mean, to be able to do that, because
Yeah.
it's maybe a more realistic picture. But it left us with less wiggle room with that, so.
I'm sorry to ask such a unable to answer question at this time, but thank
yeah,
you.
it's hard to
Well, I
project
mean,
that.
I guess, are you asking if they think they're going to be able to balance the budget?
Well, that's kind of a roundabout way.
Yeah. I'm hoping so. Chris, I don't know if you,
Please, 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 please.
Must have really said something wrong.
You got the boss. You got the boss.
So I would just say that you are getting an incomplete picture
Yeah.
at this point in
Yeah.
time because you're doing it early, because you needed to do it early. We're switching it kind of by the hour. So by the time that you come back to this and even in August, we'll have filled in some of those gaps in revenue and salary and figured out, applied, different pots of money and et cetera across the board. We're still waiting on our Department of Revenue net new construction numbers. We closed out a tax increment district in the city of Menominee, which will result in some additional revenue. So there's a lot of moving pieces yet. And DHS is one of the players in those. That's because it's such a large budget that will be significantly impacted by the
Right.
various changes that are made over the next month.
Right. Yeah, and Paula did share that this is the first draft of the budgets that were required to be submitted last week. So there's a lot of moving pieces in here. Dr. Hall.
All that being said, we can be pretty confident that the first episode psychosis traces program is going away.
no, what we did
No?
is went from from 2 teams to 1 team.
Okay,
And
so it's been downsized.
It's been downsized, yeah.
And the independent living support
It's gone.
is
Will be
gone.
gone at the end of March 2025.
Okay,
The state announced that will not be supported, which
Okay.
is unfortunate, but.
yeah, thank you.
Any additional questions for Jerry or for Paula, either on the PowerPoint, which was very helpful, by the way, thank you, or the many, many pages of budget documents? Yes, Supervisor Bashan.
just looking through those many, many pages of budget documents, there's a lot of places you have salary and wages and you have attendance hours, and it seems like numbers kind of flip between them. Is that staffing changes going hourly salary or?
Yeah, the attendance hours is the hourly staff and then the salary is the salaried staff. So it all depends upon if somebody went from a caseworker to a social worker or vice versa.
Okay.
We had a
That
lot
answer
of,
your question, Supervisor
we
Bashan?
had, we had a lot of staff that went to social worker status and went to salaried this past year.
So we highly encourage them to get their social work certification. And so a lot of them are working on it. And then when they hit that point, they get that movement.
Okay, any other questions? If not, I will adjourn the public hearing for the 2025 Department of Human Services budget. And do you want me?
Oh, he said, thank you. I said.
Oh.
You're welcome.
Okay, all right. And then I will call our regular meeting to order. First item of business is approval of the minutes from June 27th. I would entertain a motion. Dr. Hall moves. Is there a second? Supervisor Bashan second. Any additions or corrections to the minutes? Additions or corrections? If not, all in favor, say aye. Aye. Any opposed? All right, the minutes are approved. Do we have any general public comment?
We do not.
We do not. All right, moving along. Next meeting date, and we're sorry that Dr. Hall won't be able to be here. We'll struggle. We'll struggle along without you. Thank you very much. Is okay. That's an okay date for everybody still. That's our regular meeting. Okay. All right. Now we're going to put Dr. Hall on the spot because she has done some really fabulous work on our Medicaid expansion resolution, which we approved last month. So we thought we would put this in the packet and have you walk through as much of it or as little of it as you like, but these are very helpful data. It gives you some additional background, you know, as the Medicaid resolution moves forward to legislative and executive and full board. But also it sort of helps us understand what we just did.
Yeah, thank you. So this is the educator in me, right? Wanting to make sure that we all kind of understand the background issues. So maybe we'll go through a few of the slides. Are you advancing them? Okay, awesome. So this is the
Yeah,
quick
if you can.
summary. So best I could tell, and I know Katie had tried to figure out exactly how many people, and I basically, the federal government, from the census, you can find out how many people are between 100% and 150%,
Yep.
and I just halved that number. So this is an approximate, right? Approximately 1,000 individuals would qualify. And
Didn't we come
Maybe-
up with 970?
yeah,
Close,
somewhere
it's close.
around there, right? So, you never know. And what's really, I think, exciting about trying to do this now versus many years ago, although there could have been many benefits to doing it many years ago, is that there are many states who have done this for years now. And so we have a lot of data now on the outcomes that we're seeing in the states who have accepted Medicaid expansion. And so we actually can know what we would likely expect. So what we're finding is that the health of the individuals who qualify improves in many different ways. What we're also seeing in states that expand Medicaid is it improves their local economy. So workers and people who maybe weren't taking jobs or were working low hours so that they could stay on their Medicaid now are able to work more hours. They also have improved health, and so they report that they're better able to work. And so I think one of the data points was that people on average, their average debt decreased by $1,400, right? So through, improved workforce participation, decreased absenteeism due to being ill because they're able to actually take care of medical problems when they arise. And then, reduced risk for evictions, and then you keep a good credit score, and then you can get a mortgage. And so the economic impacts are really quite significant. When you look at the financials, what you find is, again, as many of us would know, an ounce of prevention is worth a pound of cure. If somebody has health insurance, they're more likely to go to the doctor earlier. in the sign of an illness and not wait until it gets really out of control. So they are finding some cost savings from that. They're also finding, because the pay structure is different for those who are in that 100 to 135% of the federal poverty level, which is what the expansion covers, the federal government pays a larger share of that than they do for the traditional Medicaid. So what other states have found is many people who used to be in traditional Medicaid start working a few more hours. Now they qualify for the expanded Medicaid, and the federal government is footing more of the bill. So in many states, actually, it has been cost neutral, which is pretty exciting. And then the other thing, which I think is really important for us, is hospitals. So rural hospitals in states that take Medicaid expansion are 60% less likely to close. Right. So, and so I don't think we'll go through, we have a big agenda. So I don't think we'll go through all the slides today. But yeah, there's a lot of them because
There's a lot.
I just can't help it. But right, the year before they closed, Sacred Heart lost $61 million. Now, that was not all uncompensated care from people who couldn't pay the bill because they didn't have insurance. It wasn't. That is a small piece, but it is a piece. And what the data from other states is showing is that it's a piece that matters in terms of, because oftentimes I think the median margin right now for most hospitals is 0.2%. That's their operating margin. So even if it's just a couple $1 million one way or the other, which is what uncompensated care often is, it's usually about 1 to 2% of your gross patient revenue. That can be enough to make or break it for hospitals. And so hence we see the decreased risk of closures in states that have expanded Medicaid. So there's much more detailed information in the slide deck. If there was something that you saw in there that you have a question on, if you happen to look at it in advance, I'm happy to try to answer that. But yeah.
Any questions for Dr. Hall? And thank you.
Yeah.
Yes, Mr. Lamb.
Not a question, but this happened inside my office this afternoon when I looked at this and printed it. And I said to two of my coworkers, one of whom is adamantly opposed to Medicaid expansion, one who's kind of neutral. The person that was adamantly opposed to it happens to be my boss. I said, check some of the sourcing. He yells back from his office. And he says, I hate to admit this, but I think you might be changing my mind. So,
Dr. Hall.
So
Yay.
I'll keep reporting where he's at as we move forward, but that is 100% true. So.
Well, right, the goal is for people to make informed decisions, right? Because as we all know, sometimes, although something looks like it's expensive up front, sometimes it ends up saving you a lot of costs on the back end and can actually be better even just dollars wise, let alone from health and well-being, which we also care about in our communities.
Absolutely. Well, this is a great piece of work and it helps us a lot. Yes, Supervisor
Madam
Dean.
Chairman, I'd like to thank Dr. Hall. This is very good. I've been beating the drum for this a long time, and this helps put it in dollars and cents. It removes the partisan approach, and it's just dollars and cents. And most Republicans that I know are interested in good use of their money. So thank you
Right.
very much.
You're welcome.
All right. Anything else? All right, moving on to Veteran Services. Greg, are you ready for a report? Thank you. Right. Sophia, could you turn on your microphone, please? Thank you.
First item I'll start with is just discussing some of the office activities. And again, I break it down by some our local efforts and what we touch in the community. First thing, just basically attending and being a smaller part than we've been in the past with the downtown Flag Day ceremony. Do a wonderful job at the memorial is across from waterfront, and it's always a very, very tasteful ceremony. And they go ahead and read off the names and new bricks that they put down, and partner with Stout to have the bells go right at the end. So it's a very, very tasteful ceremony. I've seen an uptick in homelessness, and I'd be interested in my colleagues if they've seen a little uptick as well. Kind of seems like it's the season right now with individuals trying to get a few things figured out regarding that. So we've got one difficult situation, which I just had another difficult one come in the office, where there sometimes individuals will leave the military in not such good standing, and that complicates the access to benefits. The Veterans Administration will always approve health care for those individuals. If they broke them, the Department of Defense hurt them, they will provide health care only, but not any type of financial assistance. On our end, of course, our role is to help navigate and access that. But we will, example today, gentleman come in, I just load him up a bag with a quilt, water, gave him my leftover brownies, and he's kind of on his way with a poncho and knows his resources and stuff. But that he's just got out of jail. We've had contact in the past, but it's basically just kind of bridging a gap, letting them know that our building, all of our staff are here, willing and able to try to help. But there's certain things that you're only going to get access to. So he's got a plan, and I can't say enough praise for our behavioral health officers with the city of Menominee as well as Dunn County. What an incredible resource. We've used them a lot. And again, the ability for them to react and help. And we've had just a number of very unique situations, from needing their help to get guns turned in from a domestic situation to helping transport some I love my kids' cards back and forth, and it's been good. And again, they, I can just see a lot more of that need in a support and just reaching out to them. So I would assume my colleagues probably had some of the same interaction. They do a good job. So I want to give them some absolute praise, because they have helped us in some tough situations. And then another individual, their house, they're homeless because their house was determined to not be habitable. And that's an easy one to resolve because we can access resources. So we're working through that. On the state level, the Wisconsin Department of Veterans Affairs is doing a very good job in providing some monthly, hourly education on the benefits that they have and how we can access them and partner. And I see that as a very good connection, especially with a lot of the turnover, change, and just refreshers that we all need in the jobs that we do. There's no new state benefits proposals at this time that we're tracking. On the federal side, there was three more toxic exposure presumptive diseases added to the overall list for our Gulf War veterans, and male breast cancer, urethral cancer, and the cancer of the paraurethral glands. And so I put that on there just on an educational basis, just to so the group can see how compounding the impact of toxic exposures. And it's not just the military. It just so happens that there's a lot of visibility on the toxic exposure with the military. But honestly, in a lot of cases, it's no different than our mechanics down the road that should be practicing good personal protective measures as well, to make sure that they don't fall victim to some of this stuff. Financial side, I've got first round of the 2025 budget was submitted in our 2024. I don't have anything significant to report on the 2024, and I'll just kind of touch on them a little bit after going over our veteran served report, and then I'll hit some of the highlights on on the 2024 as well as 2025 budget. I included in the Excel document the impact statement. I also included the 2023. I think I failed the last few months to include the comparable. So if you wanted to look at past year around this time versus current, so you can do some comparison with that. On the impact statement, I'll sake of time tonight, I'll just hit on the number 2. So our offices chose not to ask for any funding to do a mass scanning of old files. The effect of that is a slow, long-term process, but the upside to that is what you can find when you're touching those files and putting them in. And this is the number 2 is a result of that, of a find. When we've had a number of these, and so in looking in at the death certificate or looking at some of the discharge documents, little pieces pick out that will send us down some inquiries to see if we should be trying to find this individual, reaching out to this surviving spouse to check on benefits, because things evolve over the years. And so this was a really nice positive outcome, all as a result of just taking the time scan. It's monotonous, but there's times in the year where you want monotony and just listen to the hum of the scanner. And so there's good benefit from that.
Obviously.
So I will, if there's no questions about that, the other item I believe I included in there before I get to the financial side is an educational piece regarding the VA healthcare system, the VHA. The VHA and their priority groups. The main thing is priority. When you're placed in a priority group for veterans healthcare purposes, what that does is that identifies what your co-payment is. However, any co-payment that a veteran pays to the VA is pennies. So there is no bad co-payment. Your maximum co-payment for specialty care is $50. If I wanted to go get a new knee and left same day, it's gonna cost me $50. And that's gonna be done by good surgeon at Mayo, good surgeon at Oakleaf. And so these priority groups are placed in, they're based upon your disability percentage or based upon specific events. If you were a prisoner of war, or if you're a Medal of Honor recipient, absolutely you should have the best care and the most cost-effective care. And if you have a 50% disability or greater, you're in the top priority group and you do not pay any co-payments. You get travel pay to go to your appointments because they want people to be healthy. Get to your appointments. And within this, I won't dive into each one because you can kind of look it over at your leisure. But two of them are important that are to look at and to care for those that are in the most need that may not fit into that category of severe disability from the military. They have, if you are below the poverty level, you will fit into a priority group, this priority group 4, or I'm sorry, priority group 5, where you will not pay co-payments other than for medication, and you're going to qualify for your travel pay. Again, the most needy are going to be able to have that opportunity to get their care. That priority group 4 is another very significant category. If you're catastrophically disabled, example being, as long as you served honorably in the military. Example, a few years ago, gentleman made good decisions his whole life. Very, very nice income, assets, horrific motorcycle accident, paraplegic. In terms of the VA healthcare, and you do not have any special qualifiers, it's income based, so you wouldn't have qualified. But because of that catastrophically disabled, they're going to care for you. And so they bring him in, and so he's able to get into a spine center, and so that's a good outcome. And then there's hospice as well. Hospice, you jump right to the front of the line, because again, time limited. We want to be able to, they want to cover that comfort care. So I'll kind of end on that. There's a lot of other specifics, but co-payments, $50 for any specialty care, get hearing aids for $50, unless they cause the damage, then you're not going to pay anything. Otherwise, office visits are $15. So, and medication, generic, $5, 8 for mid-tier, 11 for name brand for 30-day supply. To kind of have an idea, like what's the cost? What have you earned? What have our veterans earned, and what do they have to pay for? And in a lot of cases, they're not paying for the stuff that the Department of Defense did to them.
Dr. Hall.
Yes.
So this is kind of related. So you referenced that, you might have your surgery at Mayo or Oak Leaf, and that's through a program called community care, where if someone lives a long distance away from one of the big specialty VA medical centers like Minneapolis, then they can be referred to what's called community care. So I have a colleague who works in the VA system, and apparently that program, which is important and wonderful, especially for people who live far away from Toma or Minneapolis, has been exceedingly expensive since it was instituted. And so the VA is changing how those referrals go and making it a lot more onerous for the primary care folks to process and submit those referrals in an attempt to disincentivize them. So, and they're also anticipating that there will be more denials of community care. The other thing that is being reported to me is that they're having real terrible trouble recruiting and retaining people, especially for the rural VA medical centers. So Rice Lake has had an unfilled position for 3 years. And I think one of the rural places, I can't remember the name, but up in Minnesota, like they lost 3 out of 4 of their staff recently. And they also told me that the VA is on an unofficial hiring freeze too. So if people leave, nobody can come in. So my question is, are you here? So what I'm hearing from people who are the clinicians in the VA system is that things are getting really difficult and really, really squeezed in lots of ways. Are you hearing that from the veterans that you're working with? Is it trickling down to them at this point, or are they doing okay? Or
Not from the veterans. Everything that you indicated, I've heard that even on the Veterans Benefits Administration side, hiring freeze, reduced overtime. But the community care, first off, the community care program is since I've been doing this, best program that the VA has instituted for the care. And then the second best thing is them getting a different pay source, which was Optum through United Health, which brought Mayo back on because we didn't have Mayo for a long time. So things were very, very complicated. So I know that the provider, the lack of providers in our rural area has been an ongoing issue forever. If it's not Rice Lake, it's Chippewa. But thankfully, nurse practitioners, incredible. So they hold things up, and if they need an MD, they get them on telehealth up to Minneapolis and resolve. It's just a couple extra steps. But I think until the VA corrects some of their salaries and incentives for individuals to take some of those positions, it's going to be a forever challenge. But it hasn't trickled to the veterans yet. One of the things we try to do, as you, very, very good educational piece on that whole process, insider track. But I think what we try to do is to talk process, educate the individuals on the process that can decrease the frustration. So we help set realistic expectations on when they should get a call back. Yeah, there would be a lot, be a huge fight if they try to take away community care. It's an incredible for our community, incredible.
Interesting. Yeah, Supervisor Steen.
Yeah, Greg, a few years ago, there was a turnover in administrative judges when you went to appeal for disabilities, and there was a learning curve.
Mhm.
How do you find that situation now? Are they on board, or how's it going?
Go just kind of ebb and flows with that. So I can tell you, like here recently, it seems great because I've had 7 Board of Veterans Appeals here, and just had one today. So I'm like, oh, that's great. They're at least finally calling and bringing these forward on the docket. But that doesn't mean just because I'm seeing that doesn't mean somewhere else in the country that they're just just
Yeah.
clawing to get them. But there's a massive backlog, and again, that trickle down effect that was kind of taught, it's going to hit every area, because it's a tail chasing program, because you move staff from one section to another to kind of tamp down so the smoke doesn't become a fire, and then you move it
And you
around.
move
That's
it, send the fire someplace
yeah,
else.
yeah, and that's how business is done at times.
Thank you.
Yeah, I don't know if that was a great answer. It's an answer.
It's an answer.
If there's no other questions, I'll jump in quickly to the 2024 budget, and I don't have anything significant to report. That I worked with the finance office, just had to change one GL number, and that's we're such a small budget. That's so insignificant. We just listened to $13 million
16 million.
budget. So I don't want to dive in. It's important to me. But but everything is on track. We have a large amount because we carry forwards some donations, and that's
Yeah.
where I'm gonna try to use some of those funds in the event some of those individuals don't quite qualify for the other federal service. We have a little bit of ability to use that. I'll quick overview on the 2025. So submitted it, went to pull it in, to drop it into the Health and Human Services. The one I submitted was absolutely different than the one that came here. But that's why I met with Beata and Sophia early in the week, and because formulas and the migration of this stuff.
So this is inaccurate?
It is. Yeah.
Okay.
But it changed from what I had done, and I think it was because
Okay.
the numbers that I put in just in a couple areas, because I inputted hard numbers into a couple formula areas that didn't talk well with what she had. So it's all corrected.
Okay,
We
all right.
met this week, and I can the overall the overall ask as it appears on the 2025 submission is a $10,694. That's you look at that overall ask. However, we met early this week. There'll be another one. It's about 6,800, 8,000, but with meeting with Beata, because of a few other things in relation to some funds, zeroed that out. That'll follow. The overall expenses not change. But on this document, the difference, we're light 10,694. I can hit a couple of the areas just with move. I moved some of the my salary and in lieu of fringe into the grant. Our grant increased to 13,750, and that was our budget adjustment.
Right.
And so I built the budget going into 2025 using that. And so I moved some salary in to kind of help with pay for some of that way, rather than using some levy. Small numbers, but it's impactful in our budget. We go down to the highlighted areas on it's page 2, which is our operations fund, with the last 2 digits of 10 under the fund center. And I asked for an increase of $100. So, but for the cost of living. So 5,707 is what we're asked for last. I think it was 5,607. So an increase of $100. We move into the veterans relief. The veterans relief last year budget that was approved, I keyed in like 11,000. I transposed a number. It was 11,000 something. This year I corrected it to 13,146, which it had been static for 15, 20 years at that. That's money dedicated for veterans relief. And so there, that really equates to about a couple $1,000, 1,500, couple $1,000 change there. And you can see if you want a detail on how I intend on spending certain areas, you can read in the highlighted in the right, just give a little bit of a description. In the grant area, increase that 13,750. The document submitted shows that budget adjustment, so it reflects exact same as 2024. I just went ahead and moved a salary at how Beata helped me to use bring all the additional salary costs with that, but the total dollar amount didn't change. So she brought over like the Medicare costs and dental. I just moved a number, and also the in lieu of fringe for a part-time person. So that's why
Yeah.
you'll see some of those comments more. So for myself, to kind of memorialize my thinking at the time when I built this. And then you can see just the small changes and shifts. So I'll entertain any questions for this first round. And
Any questions for Greg on the VSO first draft budget? All right,
okay, thanks.
well done. And moving on to the Department of Public Health, KT. It was big.
Let's try that.
Thank you, Dr. Hall. I didn't notice.
So you do have a large packet. We can talk through some of the items. I also handed you a one-sheeter today. And just to give you kind of an overview, much of it is related to items that you already saw with press releases, as well as the community health needs assessment for Dunn County. A couple other things that I wanted to highlight out of the one-sheeter that I handed you today. We did a lot of outreach in the last month. And so I'm really proud of my team for being out in the community and doing some of that fun stuff. So we had a partnership with Birth to Three, where we were able to fit any of the families in for car seat checks. And if you've ever tried to put a car seat in a new vehicle, there are so many more straps. I mean, I realized that I grew up in the era of like jump seats and no seat belts, but it really has changed. And so for our public health nurses to sit with families, we had 14 families, multiple seats for each of those families, and make sure that they had the confidence that they were installing their car seats correctly and that their kids were as safe as possible. That was definitely a feel-good thing. Yeah, anything? No? Okay. And then you definitely saw, hopefully on our earned media around the public health kiosk. Super excited to see how well that was received. Our social media post actually was shared over 100 times,
Hey,
which is
good.
fantastic.
good.
And have done some interviews with different radio stations and local print media as well. So recognizing that there is a lot of need out in the community, folks do want to understand all of the different harm reduction strategies that are in that kiosk. They're all free. If you need a gun lock, if you need a deter bag or a bag to properly dispose of medications, or if you need other harm reduction materials, we have that in the kiosk. It's nice and anonymous. You don't have to interact with a person, and it's really simple. Pop in, start with the touchscreen, and you leave with something in a little bag that you can't tell if it's literally socks or if it's Narcan. So sharing that. And then my hope is that you did spend some time with our community health needs assessment.
Yeah.
You did see the press release as well as the Leader Telegram coverage of the community health needs assessment. This, as you will remember, was a tri-county initiative where we pooled resources in combination with our partners at
Marshfield, Mayo, and HSHS before they went under to do a statutorily required assessment of the community. This assessment is different than last cycles. And those are, of course, Dunn County, bucolic, wonderful rolling hills. It is a little bit different this year because we weighted the data differently. So the quantitative data or the data pulled from sources like Census, the Robert Wood Johnson Foundation, were weighted at a percentage, much like the community conversations and our Health Done Right Community Coalition meetings. So slightly different than last year. Last cycle. What this assessment really highlights is where the data says we struggle. And so you saw some things that we didn't see before. You saw childcare access, you saw access to medical care, and it's only gotten tighter. And then you saw alcohol misuse. So we had alcohol, nicotine, and drug misuse as a community priority in our last iteration. We can still do a lot of that same prevention work with the same action team, but this really puts a finer focus on things like the number of motor vehicle accidents that involve alcohol in Dunn County. We do worse than our peers in Wisconsin, and Wisconsin as a state does worse than other states. So things to highlight for you. We will be working with our Health Done Right Coalition to put together a new community health improvement plan. I love the acronym CHIP. You hear me talking about our CHIP, that's what it's about. And so we will really use that data to focus our efforts over the next 3 years.
I thought it was really well done. Nice to see it.
It was good. And like I've shared previously, that is specific data to Dunn County,
Yes.
even though it was a tri-county consortia or combined effort.
Dr. Hall.
So I just want to say on the record how much I appreciate that the data was weighted more heavily this time around, because I think it gives us a much more accurate picture of what actually the problems are rather than what people think the problems are. Perception is important, but actual numbers are important too. So I really appreciated that shift.
Thank you. Any questions on what was in your packet? So you had the community health needs assessment, the 6-month Epi Express, so the Bureau of Communicable Disease. I know you guys are all with bated breath looking at the number of communicable diseases in the state. I know I do. The maternity mortality team recommendations. So again, when we look at maternal mortality, what are those causative agents and where do we have an opportunity to get out in front of them? This is a statewide report. The numbers are not big, but any maternal mortality is not appropriate.
Exactly.
In a country like ours. And then you saw the respiratory virus surveillance report. Happy to see that the influenza season has finally stopped. It's about time. We are seeing some influenza B, but not a ton. And then of course, like I shared in the packet last month, we are continuing to work with our agricultural producers, our friends over at Extension of Dunn County around avian influenza, high path avian influenza in our dairy herds. In Wisconsin, we have not had a herd test positive, and we are the only state that is testing that can still say that. And so continuing to do surveillance testing of lactating cows, but we have not had a positive here in Wisconsin. Any questions about that series of updates?
Any questions for KT? Okay, go ahead.
So you also have our first go at the 2025 budget for the health department. Much of what Paula shared is also applicable to the health department. We are seeing the termination of a lot of COVID funding. And so that directly represents or translates into funding challenges for the health department. What has offset our funding and why you see basically a balanced budget is because myself, our public health nurse manager, who is backfilling my position, and the position for the support for the ERP are taken out of the health department budget and put into ERP. So that represents, like Paula shared, $192,000 that are ERP related expenses without a corresponding revenue. Other than that, I am submitting a balanced budget. We are using a little bit of public health infrastructure grant, which is separate from COVID dollars to continue to support specifically some of our health educator time. But we will continue to, through 2025, grow our revenues, which are down in this budget. It's responsible to show that they are down, and also continue to grant seek like many of our counterparts. Any questions on the 2025 budget?
Dr. Hall?
So if you push the thing down, sometimes when people handle it, like pull it by the, so push it down into the,
Push down to the base.
This one like turned off, like the battery died on it.
Yeah,
so
mine's not
might be
working.
a battery issue.
All right, I'll use this one. All right, thank you. So, so the grant revenue, right? So we've got, it's going down by almost $400,000. And so also are the expenses in this summary. So what are the programs or services that we have been providing will we no longer be providing in this proposed budget?
yeah, great question. So a lot of it is public health ARPA. And so everything from some of the funding for birth to 3, as well as the other spend out plans that we had that were recovery oriented, those will not continue. We have seen a pretty significant reduction in some of our reproductive health funding. Title 10 specifically has been cut, and we are in conversation with the 5-county consortia for NP access. My hope is that we can increase revenue through increased use, and we can offset some of that loss of grant revenue. At this time, we have not reduced staffing. Other grants, they are by and large even, but that results in a functional cut because of course our staffing costs go up. At this point, we have not had a decrease in programming. We have had and are showing a decrease in nursing hours as we do anticipate a very well-deserved retirement and hiring in someone who wants less hours. So that's helpful. And then our public health educator, when our wonderful health educator went to the city of Menominee, we hired that position back in at a 0.6 FTE instead of keeping it at a 1.0 FTE. So we're making some adjustments. And like I said, at this point, we're not cutting programming. And my hope is that we can continue that.
Great, thank you.
It sort of looks like my mic just powered down. I don't know what anybody else is doing. Let's try to do the best we can. I've got Gary's.
It might be an electronic coup.
Yeah, we're being taken over.
It is the gnomes. Any other questions about 2025?
Any other questions on the 2025 budget? Sort of disappointing to see the grant revenue go down so precipitously, but we knew that was going to happen.
Absolutely. Absolutely. We don't fund prevention very well.
Mhm.
We respond, and you guys probably remember that from 9/11 where there was this influx and then it went away. And so we're seeing that again, not unexpected, but still challenging.
Yeah, absolutely.
So 2024 budget year to date, you will see that we are also showing a net positive, and that is also due to ERP. So we are moving through the enterprise resource planning process to replace our current ERP, which is SAP or SAP, people lovingly call it, because it will go away. As we know it, we would have to change anyway. So my time, like I already shared, goes towards that, and we are seeing that reduction in our overall budget cost. Any questions?
Says there, well, there are 2 bars.
Okay, awesome.
All right. Anything else for KT? All right, moving along. the Department of Human Services. Paula, you're back on.
Thank you. You'll find in your packet my director's report. Due to the time tonight, I'm not going to spend a lot of time on it, just highlighting a couple things to make you aware of the RWC, some changes and different things that are occurring there. So make sure you take a look at that piece of it. And special kudos to Bertha 3, who had a audit, and they did an exceptional job during that audit. So any questions on my report?
No, but well done, Becky.
Okay. So then the next document I would bring you to would be our 2024 fiscal report. Oops, no, I grabbed the wrong one. My apologies. Financial report. There we go. All right. So at this point of the budget, our projections are at that we will have an excess of revenue of $639,092 based on what we have received so far for expenses and revenue.
Any questions on that? And, with this kind of crazy DHS budget, it's always nice to see how well you manage scarce resources. So thank you for that.
I would add, there are things that have newly come up. For example, just this week, we needed to do a medical detox on an individual that is at a very, very high level of alcohol and in his body and needs to be detoxed medically. Alcohol is one of those areas that if you don't detox medically, you could die. Very significant concerns if that doesn't happen. And the nearest one is Green Bay. So we had to have law
I
enforcement
know, right?
transport over there and pay for almost $1,000 a day detox over at a provider in Green Bay. And then once he's detoxed, to bring him back. Long trip when you're detoxing. But with the closure of Ellie Phillips.
Right.
And so those are things
Right.
like we didn't expect in the budget, but you can bet that we'll see a few more of those. And that's life and death. We need to do those services.
Dr. Hall.
I'm wondering if, especially as we talk about, legislative priorities and all those types of things, if we can start tracking things like that, like every time we have to transport someone all the way across the state, just keep track of it somewhere. Like these are expenses that we wouldn't have had if we had a local option that might be useful to us
Sure.
in helping explain why that's so important.
Good idea. Thank you.
That is a good idea.
Yep.
Mr. Lamb, did you have a question?
Given that's the closest one is in Green Bay, it does, and I imagine this isn't possible, but is there any option to do something in the Twin Cities? Is there, I don't know if there's some sort of, I don't know if there's any way to do that, if there's any program through the state or anything.
I would need to look at resources. So in this case, the individual went voluntary, which is a factor. So when they do not go voluntary and it needs to happen, we lose jurisdiction when we cross a state line. But in this case, because it was voluntary, there may be a resource that I'm not aware of. We would have to do some research on that. So it's a good question when it's voluntary. If it's not voluntary, you can't, but yeah, because you don't want to lose jurisdiction, but something I'll look into or have staff look into. Thank you.
Yeah.
Mhm. Okay, I think
Anything else?
that's all that we have on ours. I already did the budget.
Already did the budget. Any
proposal, so
further
we're good.
questions on the budget before we move ahead? All right. Down to action items. The vouchers for June I need a motion to note review and will happily answer any questions.
I'll
Mr.
make that
Lamb
motion.
moves. Is there a second? Dr. Hall seconds. Any questions? Dr. Hall?
So I noticed there were more, or at least to my casual anecdotal, it seemed like there were more entries for foster care than we typically see. Is
There were a
that
lot.
a reality that we're experiencing
It
right now?
is. Mhm. Mhm. And like I said, when you have challenges with child protection and you have smaller families, you may have one or two that go in care, but when you have large families and you have that significant issue, it's just a greater impact from that. So same amount of families maybe, but larger.
Larger number of kids. Any questions on the vouchers? And thank you for looking at them so carefully. All in favor? Aye. Any opposed? All right, the vouchers for June are noted. The next item is a budget adjustment for the Human Services Department. Grants in and grants out. Are you moving? Moving to approve?
I move to approve, yeah.
Thank you Supervisor Hagan. Is there a second? Ms. Rudy seconds. Any additional questions on this? If not, all in favor say aye.
Aye.
Any opposed? Budget adjustment approved. A budget adjustment for the Department of Health. Again, it's money in, money out. Any questions?
I so move.
All right, Supervisor Steen moves. Is there a second? Who has the second? Supervisor Bashand has the second. All in favor? Aye. Any opposed? All right, there we go. Then we have a mental health resolution that just got drafted. We received requests from the Wisconsin Counties Association, basically asking every county in the state to do a resolution similar to what you have before you so that they can move with almost unanimous support to get something done at the legislative level. I assume that you have all read it. I am certainly happy to go through this if that would be helpful. Ms. Winter.
So I made a mistake, and in your packet, there was an attachment called crisis response, and it was something from Real Living that had nothing to do with this. My apologies. At about 3 o'clock this afternoon, I realized that's what was in there, and so I deleted that, put this.
Yes, this is the request from WCA.
Oh no, my thing died.
Dying left and right.
Thank you.
Sorry, out there, people. We're trying to communicate. We really are.
Yeah, so it gives a background. I do want to share that we talked about this at our WICSA directors meeting, and this type of approach was taken by child support last year for funding, and every county in the state supported it through resolution, and then there was a great impact because of that, and so they felt the same approach might help with this very needed area.
Right.
So,
All right. Do you want me to read through this? Or are we good? So this will need to go to, again, to the legislative committee, to exec, into the full board. We tried to keep it a bit local, as much as we can. Yes, Supervisor Steen.
Do you want us to approve it?
I do want you to approve
I move we approve.
the resolution.
Yes.
I'll second.
All right. Any further discussion?
I just have a quick question.
Yes, Supervisor Hagan.
If this gets voted on and approved at the very bottom of it, and it gets all the way to approval at the full supervisor meeting, where does it go? Like from there, does it go to the Wisconsin Counties Association first, and then that gets distributed from there, or do we simultaneously send off to?
I believe the way that these have been written is that they go to WCA.
And then WCA will distribute it. for all 72 counties or so. Is that
That
correct?
that's my understanding of the
Okay.
process that they laid out, Dr. Hall.
So in the resolution itself, it looks like it says that a copy will go to the governor and the state legislatures who have constituencies in Dunn County and to the counties
And
association.
generally speaking, that any of
Yeah.
these kinds of legislative resolutions are distributed in that way. The
Perfect.
clerk does that.
So just, yeah, it spreads.
But this
out.
one
Okay.
is basically addressed to WCA.
All right,
Okay.
thank you.
Did we vote? We did not. We did not. All in favor?
Aye.
Aye.
Any opposed? All right, mental health resolution moves forward. And then as you recall, as our final item, we tabled the our legislative priorities last time because we had additional time. What we've done on this one, it is exactly the same except for item K. And this came as a request from the Planning Resources and Development Committee. There is a state well compensation program for people whose private wells, the community non-transient wells, et cetera, that provides compensation to the owner or the manager to fix the problems identified. The criteria for approving that compensation is sort of ridiculous. Like, it has to have had cows on the property. It requires an income limit of $65,000 a year. So this is a request brought by Chase Cummings to us to change the eligibility requirements for that well compensation money. What we did last year in the legislative agenda, so we have a couple of water quality items in ours. Those are listed as a dual committee recommendation. So this one probably would be as well. It just makes sense to legislators to read it that way. So this is the same document that you've looked at, I believe, twice, with the exception of number K on the well compensation grant. Are we ready to approve the legislative agenda? Dr. Hall.
So you may know, so at Stout, I teach, but I also advise the pre-health students. So I pay a lot of attention to health profession schools and what's going on. And then as someone who's worked on the clinical side of things, I pay a lot of attention to the healthcare worker shortage that we are experiencing nationally, and most especially in our rural areas. And so when you look at the numbers, it's actually quite clear that we have a huge pipeline problem in terms of the numbers of seats in medical schools and nursing schools and all of our allied health programs. Part of that is because the American Medical Association put a freeze on increasing numbers of medical school seats for 2 decades, so that then physicians could command higher
Salaries would
salaries
go up.
because of supply and demand. Yep. And then, so, I mean, the number of newly minted physicians we've been making in this country, even once that kind of moratorium lifted, has not kept pace with the population growth at all. And most especially has not kept pace with the increasing medical complexity of people who, 20 years ago, if you had lung disease from smoking and type 2 diabetes and you'd had a heart attack, you weren't here anymore. But now you are, and you have lots of complex medical needs. So the amount of care that people need is great that they are still here, but the care needs have increased even more so than just because of the population increase. So all of this is to say, and I don't know what the recent task force on the healthcare worker shortage in the state of Wisconsin, which I know they're about to make their preliminary findings or something to the governor. There was something in the news about it this week. I feel like it's crazy that as a state that has a public university system that trains people in all of these things, that we are not doing whatever we can to increase the capacity of our training programs. It just seems like a no-brainer to me. And so I'm sorry, I'm kind of springing this on all of you, and perhaps maybe we can't vote on adding that or something at this point in time, but, and I'd be happy to do a PowerPoint with some background information and show you some of the details on all of those numbers. But, so I guess what I'm asking for this evening is that we start thinking about perhaps for the next iteration, unless people feel really strongly, that we start advocating and saying from a grassroots level, from a county level, like, let's fix the problem. I mean, yes, we should strive for workplace wellness and better scheduling so we don't burn out people. And yes, all of those things. But if we just don't have enough people, we just don't have enough people. And I will tell you, it is not for lack of talented, capable students applying to the programs. That is not the problem. It is not the problem.
I'm looking at KT. I don't know if you know this. If I'm not mistaken, didn't the governor, I mean, I know that there's a task force working on it. Didn't the governor add something in his budget about nursing and medical school? Okay, I vaguely remember that, but it doesn't attach a fact to it. Maybe this is something we should, at some point moving forward, look into. Yes, Supervisor Bashan. Oh, sorry about this.
I would just say, I know with the UW system, that is an issue with if a school offers a program and it's too close to another school, Stout and Eau Claire, Stout and River Falls, they cannot offer competing programs. So that's something that would be a UW system change to get that fixed.
Or even so,
Yeah, right.
even just increasing the size, right? So, UW Eau Claire
Number of
denies 50% of the people who want to go into their nursing program.
Right.
And it's because they don't have the faculty and the facilities to
Right.
train them, right? So
Right.
even just growing our existing programs, I
Yes.
mean, I'm all for having more programs in multiple parts of the state, but even
Do it
just,
all.
yeah, let's just do it all everywhere. But whatever we can do to grow our existing programs.
Yeah, and it's one of the reasons why the Neighbors of Dunn County now has its own in-house CNA training program, because they just can't find the staff. And if they can't find the staff, they have to close the house and lose the revenue. And I
Yeah.
mean, it's a big spiral.
Right. And just to give an example of so today in the mail, I got a flyer. So even though in the National Registry, like I've already said, I'm no longer clinically practicing medicine, I still get every week, I get flyers recruiting me to work different jobs. And this latest one was from Iowa, and they would give me $250,000 sign-on bonus. Like, that is how bad the shortages are. Right. And so when we think about healthcare costs, when we think about hospitals closing because of increased salary costs, which is actually one of the main drivers of hospital closures, right? All of this is linked. All of it is contributing. So
Yeah, well,
we need to fix it.
yeah, we need to fix that. Thank you for bringing it up. All right, are we ready to go with our legislative priority package? All right, all in favor? Aye. Any opposed? All right, this is going to the legislative committee, and the chair is right here. You want to tell us you want to say anything about what we're planning to do with the whole legislative priority list? Here.
I guess I'm out.
Here. I have a new battery. There you go.
Yeah.
Try to kill you.
Yes, I was just conversing with our county manager about when we were going to meet again. We're going to discuss that, and we'll bring it to the legislative committee. They'll adopt it, bring it back to the executive committee, who will bring it to the full board, and then it'll be forward to the Wisconsin Counties Association. And we have a meeting August 8th or 9th in Eau Claire, the board of directors of the WCA, and so I'll be attending that. And I might run off a pile of copies on your report there, because our main lobbyist, Kyle Christensen, who is located just down the hall from our chairman, this might be interesting for him to lobby on, because, and I can talk to the other county guys, because I'm going to guess that they haven't broken it down this way. And I think if they would, it would have a lot more impact. Now, my feeling is, and Kyle, that I don't know if there's any appetite for adopting the Medicaid money right now. It's getting better, but just to show you how tough things are to move them, they worked for about 10 years on changing, just getting all our money from the state without that sales tax thing. You know, they changed last year and they're going to raise some of the money out of the sales tax, which is a great step. But it took them 8, 10 years to move the legislature to do that, you know. So, and
And the decisions being made about this are not exactly based on evidence.
no, and I will just say this, although I suppose that you consider me a partisan, but the WCA is nonpartisan. They have to work with who's ever in power. So they are cognizant of not burning too many bridges, but being effective with both parties. And so, and I think our lobbyist is very good about laying out fact-based stuff, but that doesn't mean that the rest of the counties will buy on, because some counties are in a lot better shape than we are. You know, and we're only one of 72. So, but I appreciate all the efforts, and and everybody understand the moves that we're going to make. And then I can talk to our chairman, and I can talk to the chairman of the board, and I can also talk to our chairman of the WCA and get their thoughts on this and see, because I think I have good ideas, but sometimes they're not so good, and it's not time for them. So I need some guidance on how to approach this stuff. But I'm happy to share all that stuff, and that's one of the reasons that we established a legislative committee in Dunn County here, because to have an avenue for people from the taxpayers to come and bring their issues, and then I guess we're the gatekeeper, so to speak. If we think it is relevant or it needs to go on, we push it on without having them stand up in front of 29 people and a whole audience and bring their stuff. So anyway, and I think it's a good thing, because we can allow people to vet, to bring their concerns. And I think a good part of government is that you allow that, because if you don't, the people feel they're ignored. And that's not our job. Our job is to respond to the taxpayer. They don't always like to answer, but they should have the courtesy of being listened to and given an answer. So hopefully I fleshed it out a little bit for you. Yes, Dr. Hall.
So I just wanted to add that there's a physician group called the Committee to Protect Healthcare, who's planning to do a big PR push in Wisconsin next month around Medicaid expansion and what it could mean for the state. So it might be a ripe time to get conversations going and get people thinking about it.
And I would really like to thank the committee. I mean, to the extent possible, we've tried to make these data in both of these resolutions particularly relevant to Dunn County. So thank you for asking for that and sort of pushing us to make that happen. Any announcements? If not, we are adjourned. Thank you all.